Good evening, everybody. I'm Sayukta from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown-colored patches on their face. They seem like freckle-like spots forming large, flat patches. This is nothing but melasma or hyperpigmentation. Melasma is a common chronic skin condition in India. According to a study conducted across 4 Indian cities, reveal that more than 80% of the population present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone more prone to pigmentary disorders. It occurs mainly in women, 90%, and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65 years old women present a facial melasma. Melasma and hyperpigmentation generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustrating setback in treatment. To avoid all these hassles and to keep you informed today, we are here to know about management of melasma and hyperpigmentation from an expert. So let's connect today with our skin expert, Dr. Alekya Singapore, live from Hyderabad, to talk on how to get rid of pigmentation. Dr. Alekya is a dermatologist, cosmetologist, and trichologist. She pursued her graduation and post-graduation from the prestigious Deccan College of Medical Sciences, where she held an excellent academic record. Dr. Alekya is the founder and consultant dermatologist of the SKIN SENSÉ by Dr.Alekya Singapore Skin and Hair Clinics in Hyderabad. She is a consultant dermatologist and cosmetologist at Apollo Clinic, Kondapur, Hyderabad, and Apollo Cradle at Manikonda and Jubliee Hills, Hyderabad. Speciality Center for Women and Children. She is a member of Indian Association of Dermatologists, Venereologists, and Leprologists. She expertises in clinical dermatology, cosmetology, trichology, pediatric dermatology, and surgical dermatology. Today, Doctor will share with us on how to get rid of pigmentation. A very warm welcome to you, Dr. Alekya, and a very good evening.
Thank you. Good evening.
Doctor, as today we are going to talk about, issues related to pigmentation, hyperpigmentation, melasma. First of all, I would like to know what exactly is pigmentation, because it's a word which everyone knows, but maybe we are not aware of exactly what it means.
Yes. So when you say pigmentation, everyone thinks something in black color. Pigmentation is not pertaining to only color, that is black, but it could be white. It could be any change of color that's called as pigmentation. So when we are talking about pigmentation, we can categorize them into two types. One is hyper and one is hypo. Hyperpigmentation is something darker or brighter than your original skin tone, and hypo is something that is lighter than your regular skin tone. When we are looking into this pigmentation issues, most of them, as you were speaking about melasma and other freckles or tan or all of those things, fall into the hyperpigmentation category. And 90% of what we usually see in everybody is hyperpigmentation category. Hyperpigmentation is something that is lighter, so that goes into clinical conditions like your vitiligo or some other conditions that are medically associated that causes lightening of the skin than normal. So when you say pigmentation, this is what we look into, either hyper or hypo.
And if we talk about the causes, and especially as we'll also talk about melasma, I would like to know about the causes of hyperpigmentation, to be particular.
Yeah, so when you're saying hyperpigmentation, there are hundreds of conditions that we can think of when you say hyper. But they can be temporary. Again, we can categorize the hyperpigmentation into temporary or permanent or short-term or long-standing pigmentations. Depending on the causes. Now, if you want to talk mostly on melasma, melasma is something that comes for anybody at any age, but we short it down, or we try to narrow it down to mostly women who have hereditary causes and post 30 years of age, and who haven't been taking care of the skin well with a proper skincare routine, or if they've been using some random products on their skin, like a regular day cream, Fair and Lovely or Rico Turmeric, or whatever we use in a regular daily routine, or if there's anybody having hormonal issues like your PCOD or your thyroid, any other hormone issues can cause this pigmentation called melasma. Melasma is black colored marks, especially on the cheeks or on the center of your nose. Sometimes it might spread also to your forehead, your chin. But what we typically see is both the cheeks pigmentation, hyperpigmentation, that is black colored marks. Okay. So that's about melasma.
Right. When we hear, as a layman, hear the word melasma or hyperpigmentation, we think of it as to be the same thing. Are they different, melasma and hyperpigmentation?
Hyperpigmentation includes everything that's black color, and one of it is melasma.
Right. And what are the symptoms and signs of melasma?
Symptoms and signs, because it's not a medical condition, we do not categorize into symptoms and signs, but what we usually see on a patient's skin is the same thing what patients perceive in case of melasma. That's your black marks on both your cheeks. It can also spread to your nose, your forehead, and your chin.
Right. And what are the risk factors for melasma?
Risk factors, there is no specific risk factors for melasma. It's just that the spread can happen faster, or it can happen deeper, or it can get resistant to treatment. So that's what we should be worried about.
And when people come to you with conditions which are, likely to be of melasma, how do you diagnose? Are there tests, or just by physical examination you can tell that it's melasma?
Yeah, most of the time when we look at a patient, by looking at it, we can make out it's melasma. But we also do a dermoscan, where we have a equipment that we can scan the skin and understand it's melasma. And the third one is we do a biopsy if required, or if we cannot identify the marks in the patient's skin and the melasma is almost not contrasting and mixing with each other. The last one, or to confirm it, what we do is called as a biopsy, a skin biopsy. We take a part of the pigmented tissue and send it for histopathological examination. And based on the report, we'll be able to confirm it's melasma. But most of the time, it's just by looking at the patient, we can perceive it's melasma.
Right. It's said that prevention is always better than cure. Can we prevent melasma? What are the steps there?
Yes, definitely. Prevention is better than cure, applies to everything. And it's mostly to the skin. And if you're looking at melasma, that's the first thing that you should consider. To make sure that you won't end up having melasma, the first thing you would want to look at is maintaining a daily skincare routine at a little earlier in life. Now, early, when I say, it could be your mid-20s to your late 20s. That would be the time when you start taking care of your skin with a proper skincare routine. Nowadays, we see everyone is taking care of the skin at a very younger age, which is well and good, keeping the consciousness of skin to everybody. But as simple as applying sunscreen regularly, even if you're staying indoors or outdoors, and using a broad spectrum sunscreen and reapplying your sunscreen at least twice daily with a gap of 4 hours would do most of the job to prevent melasma. And making sure that your hormones are in place, your stress, or not applying the external things that can cause melasma is your hair dyes or any other thing that's triggering your skin reactions or causing dryness. Applying skin lightening or skin whitening creams, then later on stopping them, randomly using topical steroids. Any of these things, if applied in the wrong timing, can cause melasma. So by avoiding application of wrong creams on your face will definitely help you in preventing its occurrence. And again, sunscreen is definitely important. And the third one is taking oral vitamin C or oral antioxidants. So internally also you're protected from having melasma on the skin.
Okay, you emphasized on the use of sunscreen regularly. Now, yes. The thing is that we Indians mostly stay in a tropical condition where we are exposed to sun, heat, etc. most of the time. But still 67% of people in India, that's data, which shows that they don't use sunscreen. They have one or the other excuse not to use sunscreen. Yes. Now, how important is sunscreen and why it's so important?
Sunscreen is like one of my mentors have always told that sunscreen and moisturizer is like food and water to your body or to your skin. Sunscreen is your food to your skin and moisturizer is your water to your skin. So when you say how important, it is that important. How important is having your food every day? That important is applying a sunscreen on your skin. Now, as you said, yes, not everybody is interested to apply sunscreen. When I ask them, you have to apply sunscreen, they ask me for how long? And when I say forever, they're like, क्या जिंदगी भर apply करना पड़ेगी sunscreen मुझे? They get freaked out when I say that. Then I said, yes, as long as your skin is alive and healthy, you have to apply it if you want your skin to be alive and healthy. So applying sunscreen is very important, not just to prevent melasma or pigmentation or any other conditions. In general, to have a healthy looking skin or the younger looking skin or a beautiful flawless skin and spotless skin, which we all crave for, applying a simple cream called sunscreen every day in the morning, hardly takes 5 minutes for us to apply, even less than that, would actually do most of it. Most of the job that we need to have a healthy skin. It's that important. And yes, applying it in the indoors is very important, because not every sunscreens are not made just to prevent your sun rays from seeking into your skin. It could be any form of light, the entire UV spectrum. So if you're sitting indoors, you're exposed to the artificial lights. That also causes enough damage as much as the regular sunlight does. So to prevent that, applying sunscreen is extremely important. You like it or no is not a question. You have to apply is what I say.
Okay, so the mantra is apply a sunscreen regularly. As you said that it's, even if the name is sunscreen, it doesn't just protect our skin from the sun rays, but also from other rays, harmful rays,
Yes.
be it blue light or infrared, etc.
Yes.
Now the thing is that people, as I told you, that they have a number of excuses. One of them is like sunscreen makers look oily, sunscreen makers sweat, sunscreens let my skin have acne, etc., etc. How to address those excuses?
Yes, actually, as you said, it's an excuse not to apply sunscreen more than a reason or a cause of not applying a sunscreen. But again, every person has their own different skin types. So understanding your skin type and applying it or picking up your right sunscreen will not make you end up in these scenarios where you have acne breakouts or feeling greasy. Because if I have a dry skin and I apply a gel sunscreen or something that's making my skin more thicker and greasier, definitely I will not like the product because it's causing more greasiness. And if I'm having an oily skin and if I have my sunscreen that is going to trigger more acne reactions, I will definitely be not happy with the product. So the problem is not with the product. The problem is for us to choose the right product according to your right skin type. That plays most of the role when you're choosing a sunscreen. So that can prevent you from finding these excuses to avoid applying sunscreen.
Right. So it's important to understand our skin type, understand our skin need as per the environment we are in, and then go for the right formulation of sunscreen. Okay. Doctor, one more thing. You said that one good thing is that people now are more aware about their skin, and they are starting early in adopting a good skincare routine. But another thing is that nowadays a lot of, we call it market gimmick, where a lot of products are there. People are using, I mean, this month they'll use one brand, that month they'll use another. There's social media flooding with advertisements, etc. Is it a safe practice to keep on changing your brands or products, etc.?
That's definitely not good to change your brands. I don't say don't ever change it. But once you are stuck to a sunscreen, please make sure, especially certain products like your sunscreens and your moisturizers, it's very difficult to find something that suits your skin type at the same time nourishes your skin. So if you find those two, finding those two that will fit your skin type is very, very difficult. It's not as easy as it sounds. But once you find them, I usually tell them stick to your sunscreen and moisturizers. The rest of the creams you can play around, talk around, use around, or try around. But sunscreen and moisturizer is something that I would definitely not let my patients pick one, because I think I started using the sunscreen that I'm using now since my MBBS, and I'm still stuck to the same sunscreen. If I don't find them in India, I might just order it from somewhere else in the world, but I make sure that the same sunscreen comes back to my house. It's that important, because we do not want to end up having some more skin concerns while we're protecting our skin from sun. So changing brands frequently is not recommended, but trying new products is always a good thing to know.
Fair enough. And do we need dermatologists' advice in selecting the right kind of sunscreen or moisturizer for our skin?
As a dermatologist, I'll definitely say yes. But if you have if you can choose your sunscreen or your moisturizer or any other products according to your skin type into a right fit, then that should do most of the job. So for us, finding the product is important. If you're not able to figure out, then dermatologists are always there to help you out.
Now, one more question regarding sunscreen before we move to other things is, one thing is SPF level, because we are always confused what SPF to choose and what is the significance of SPF. Then when to apply, how many times to apply, etc. Please guide us on that.
Yes, SPF, when you're looking for anything that says SPF 30 and above, will definitely do the right job for your skin. No matter if you're staying in a hotter environment or a colder environment, anything SPF 30 and above should be good. Again, how much to apply? We usually say 2-finger rule. So you just draw 2 lines on your fingers with your sunscreen, and how much ever it is, you just dab it on your face and apply it. Reapplication, it usually is between 3 to 4 hours. Every 3 to 4 hours, you have to reapply your sunscreen, even if you're not exposed to sun. If you're getting into the water or trying to go into some water activities, we advise sweat resistant or water resistant. I don't say waterproof, it's water resistant sunscreens that will help you to stay hydrated at the same time sun protected, even when you're in the water. So SPF 30 and above, applying twice to thrice daily every 4 hours, and applying 2-finger, full fingers quantity is the way you apply your sunscreens.
Very well explained. Thank you for that, doctor. And now moving on, you also said that, when we apply a lot of fairness cream, I'm not naming any of it, but we Indians have this notion that our skin color should be white. We have this obsession for white, and we end up using lots of products where, which claims to be fairness cream or to make your skin fairer, etc. How dangerous is that? You have already said that it's harmful, it's dangerous, it can be dangerous. How dangerous it can?
If you're applying, most of the skin lightening or skin whitening agents have steroids in them. Not everything has, but most of them have steroids in them. So applying a steroids, when I write a steroid on a prescription, patients will like, doctor, please don't give us steroids because we're scared of the steroids. So you should also be equally scared of the steroids when you're trying to apply it on skin. Skin lightening or whitening by steroids is not an effect, it's actually a side effect. So you're ending up in a side effect that is lightening of your skin, which, because we are excited about the color, we think it's a good effect, but it's actually a side effect of applying a topical steroid. First thing, your skin can get white, but again, it is not the fairness or the wheatish complexion that we're looking at. It becomes literally white, something similar to my background. So that is definitely not a good thing. Hyperpigmentation, that's black color, red color, green color, anything can be corrected. That which turns white cannot be turned back to your normal skin. So you will end up having unnecessary white patches on your skin, which definitely cannot be corrected either with your lasers or your dermatologist or any creams or anything. Once white, remains white. So let's not go there. Second thing is it causes atrophy of the skin, which means you will have those pits or just scars dikhte hai, gade bolte. So it just forms a lot of scars on your skin, and it'll also start exfoliating or thinning out your skin. So you find that tightness, redness, irritated skin, itchy skin on long-term application of topical steroids. And the other one, which most of the patients come with, is acne. So they say, when I apply the cream, it's fine. Once I stop applying this cream, my acne is coming back. So here, the acne is not coming back. You're creating acne on your skin by applying the steroids. Steroids are causing, or they trigger acne form eruption, and that's end up in more acne. So when they apply the steroid, it's just giving a masking effect. It just covers your acne, but ends up giving you more acne once you stop it. Because the patients are not ready to see the face with acne, they tend to apply more steroids, so it's damaging it more and causing more acne. So they start their own vicious cycle. Right. And once your skin is thinned out, you're going to have red skin, peeling skin, damaged skin. So it's just, I do not want to use the word destruction, but technically you are destroying your own skin by applying topical steroids.
That's an abuse on your skin. Stop using those creams or steroid-based creams. When a doctor is prescribing you something, even if it contains steroids, at least the doctor know how to deal with it, when to limit the dosage, etc. So trust your doctor, and please visit a dermatologist if you have any skin condition. Don't do it by yourself, or don't try to do over-the-counter things. As I'm mentioning, I would also like to know how dangerous that is, because many a times, even if with pigmentation, we'll start seeing freckles, and we'll go to our chemist wale bhaiya and ask him to give a depigmentation cream or something, suggest something. rather than going to the dermatologist. Can it be dangerous?
Yeah, I hope, and I also request everyone else apart from doctors to please make sure that you guys trust doctors than pharmacists, because there is no offense to the pharmacists. They definitely know a lot of the drugs and what are the effects, side effects, mechanism of action, etc. But again, choosing what to give to which patient, please leave it to the doctors, because we've studied hard for the same reason, to make sure that the patient's skin is healthy. So our job is to protect a person's skin and hair as dermats, not to destroy it. तो अगर आपको मेडिकल शॉप वाले भैया पे इतना भरोसा है, then you should have more भरोसा on the doctors, because we are the ones who's making those pharmacies work because of our prescriptions. So please make sure that they come to the dermats first, because it will also get difficult for us to correct a person's skin once it's damaged, than to come to us when you have a condition. If you have freckles, come to us, we treat you. But if you have freckles, you spoil it, you damage it, you destroy it, and then you come to us, we'll still treat you, but it's going to take a long time. And patients or anyone will not be that patient. They want to get rid of it quickly. So instead of doing this entire, things coming in, going forward and feeling depressed, not able to treat, coming to us in resistant cases, directly come and visit a dermatologist. That should be the right choice.
Right. And, definitely when we have anything related with our heart, we have chest pain or anything, we'll go and seek the help of a cardiologist. We won't go to the chemist and say, I'm having heart attack, please give me a medicine. So please do the same with your skin. It's the largest organ of your body. If you have troubles, go and seek doctor's help. That's important.
Yes.
Doctor, we were talking about all the preventions that you said to prevent our skin from getting pigmented or having melasma. I'd also like to talk about the treatment part. What are the treatments available for treating melasma?
Treatments for melasma, there are many treatments. The first thing which I said is make sure that you don't continue using any topical creams or any abusive creams on your skin. Stop whatever has ended you up in melasma. And if you're having some medical condition, जैसे कि thyroid या PCOD या कुछ और a medical condition that's causing or triggering your melasma, we ask them to control that. And the third one is to make sure that you do not skip your sunscreen. So sunscreen is a must. First, it'll prevent it from worsening. Second, it'll make sure that the new things won't come up. So sunscreen will be the first thing in the prescription. And control whatever is triggering it, your hair dyes, your hair colors, scrubbing your skin, haldi, besan, nimbu, tomato, whatever those things are causing you just want to get rid of that marks. So doing all those things, we stop it. We make sure that the patient's skin is hydrated, so moisturize. It is very important. Topically, we give them depigmentary agents. That's like a skincare routine that they follow every day. And mostly if it is in the very early phases, like 4 weeks, 6 weeks, it should disappear in earlier with just the topicals. If it is not coming down with the creams, the next step we will be doing is chemical peels. Different types of chemical peels, deeper peels is what we do, so that the skin gets exfoliated and your new skin comes with no pigmentation. And if that is also not helping, that's when we shift to a little stronger one, that will be laser. Now when I say strong, it's strong for the pigment, not for the skin. So it's good if you can get a laser done also at the earlier phases, or a combination of peels and lasers that will help in reducing the pigmentation. But what we do is to make sure that your pigmentation is gone. For it not to come back is always in the hands of the patients by maintaining the daily skincare routine.
That's wonderful. So please consult your doctor in case you see any spots or freckles or anything related to melasma or hyperpigmentation, and don't just wait that it will just go away on its own. It won't. I'll pick few of the questions that our viewers are asking. Sia Pandey is asking, hi ma'am, I'm a 14-year-old teen girl. I have hyperpigmentation around my lips. So I was browsing through YouTube. I saw many doctors recommend a particular cream she is talking about. So I have a doubt that as I'm 14 years old, can I use that cream? Please suggest.
If you're 14-year-old, first thing is to remember that you have more of your natural skin ingredients on your skin than anyone else. So this is a phase where your hormones are also acting and your skin is becoming into a little adult type skin. So आपके जो original skin है, originality जो है, वो आपके पास ही रहता है, especially in teenage. That is the best part. So if you're having pigmentation, especially around the lips, One, all Indians have PDLs. We call them pigmentary demarcation lines. That's on both sides of your forehead and face, and around your mouth is darker for all the Indians, keeping the regional part in mind. For some it's darker, for some it's little less darker, but usually we all have the pigmentation there. Second thing is it could be B12 deficiency. So please let her check her B12 deficiency. At this age, it's very common to have vitamin deficiencies because the food timings, sleep timings are different. Also, keeping your hormonal changes in mind, your body needs also will change the amount of vitamins that you need compared to what you were having 14 years prior. And applying a skin lightening cream by yourself, by watching YouTube videos by many doctors. I can also suggest 100 creams, but we do not know what is happening on your skin specifically. So laga rahe, if it is not working, then it's definitely not the right thing to apply. Third one is if you have a habit of lip smacking. Most of them have a habit of lip smacking, applying lipsticks and making sure that they're lip smacking. So all of it causes pigmentation. And if you have dandruff also, you can end up having perioral pigmentation. So work on these things. You can stop applying the cream, apply good moisturizer and a sunscreen. If you want to apply depigmentary creams, visit your dermat. Visit a dermat physically than reading from the YouTube videos. It's good to watch for information, but not to use it on you. And check your deficiencies of vitamins and clear your dandruff. Those should do a lot of job for you.
Right. And Shalini Mishra has the same problem, how to remove lip pigmentation and any permanent home remedy or best cream with no side effect. Now, along with this question, I'll also like to ask you, doctor, that how good these home remedies are, because the first thing we like to do with any skin issues is to go and run inside our kitchen or to our kitchen garden and apply things from there. How safe are they?
Home remedies, see, I cannot give a direct answer that good or bad, because when I was a kid, I also tried a lot of home remedies because my mom used to prepare something and she used to give us and we used to apply. And as you said, white is what all of us want in India. So they used to rub us as much as possible to get the white skin tone. So that's what everybody does. And I don't say it's completely harmful, but I also say that it is not completely harmless. If you're doing it in the wrong way and using the wrong, if you have acne, you want to reduce the inflammation. Uske upar aap nimbu lagaoge, tomato lagayenge, and you'll apply some salt or baking soda. You're irritating the skin. So you calm down the skin, maintenance, whatever you want to do, you think is right for your skin, you do it. But if you're doing some home remedy and causing more harm to your skin, that is a very wrong thing to do. So it should be a balance between knowing what to do and when not to do. Now coming to the lip pigmentation, permanent home remedy. All of them have upper lip pigmented compared to the lower lip. If your lips are pigmented, it could be dry lips, it could be dehydration, it could be, as I said, vitamin B12 deficiency, or it could be the natural darkening thing, which is getting triggered because of a dehydration and causing more pigmentation. Applying a home remedy, I don't know which home remedies that she's doing in. If she wants me to give a home remedy, then I'm not the right person to ask for home remedies. And if you want to apply a cream, the only thing I say is apply a lip balm with SPF. And exfoliate your lips with any kind of scrubs at least once a month only. Don't overdo it. And more than that, I do not suggest any creams to any patient without visiting them or understanding and examining their skin properly. So there is nothing called best cream. Whatever works for you is the best cream.
And only a doctor can tell you, because then they'll get you, diagnose you and your skin. So yes. Please, if the condition persists, go and check with a dermatologist. Yes. We have Ishita Jha with us asking, is pigmentation completely curable? Because my mother has taken several treatments, but I can see any change. So is it curable? I can't see any change. So is it curable or not?
Now, I don't know, when you say pigmentation, as I said, it's a huge categorized into hundred of things. So when she's saying mother, I think it's mostly the melasma part is what she's talking about. Mm-hmm. Melasma, I don't say it's not curable, but it also can be curable. It's like both. If it is in the early phases, we can still cure it. If she has only used marks, if she has only used creams and there's no change, then definitely she has to go for treatments. If treatments are not helping, then probably it's not melasma, because it's not mentioned here. There are different conditions that look like melasma and are not melasma. So a dermat can tell you better. Several treatments, was it from a dermatologist or not, is what we should think. Any pigmentation is curable in the earlier phases, as long as it's not a mole or a nevus. But if it's just like simple tan, freckles, lentigenes, melasma, marks because of some issue, they should usually come down.
And is melasma a hereditary thing, doctor?
Yes. Most of them are hereditary, but just because your mother has it doesn't mean you should get it. If you're able to take care of your skin well, even you can be the chain breaker of the hereditary melasma in your generation. So taking care of the skin is very important.
Right. So if any of our parents have melasma, that at least we should be super conscious and start early.
Earlier, yes.
Yeah. Okay. So we have Palak Ramesh Sen asking, what's the best way to handle sensitive skin?
Yeah, sensitive skin. So when you say sensitive, I really want to understand what people say when it's sensitive, because come on, everyone's skin is sensitive. Everyone's skin is very important to all of us. So no one wants to apply some random creams. If you say sensitive, it should be that even if you're not doing anything, even if you're not touching your skin is still purging or reacting or causing acne or irritated without doing anything. कुछ करने के बाद अगर स्किन इरिटेट हो रहा है तो you're irritating the skin. It is not a sensitive skin. So we should understand between having a sensitive skin and creating a sensitive skin. So if you think Mr. Ramesh thinks that he has a sensitive skin, make sure that you maintain the pH of your skin by using a proper face wash, which is foaming face wash. That could be gentle foaming face wash with no active ingredients, just say AHAs, BHAs and all, just a plain hydrating or cleanser than a face wash. You can use sunscreen, which is lotion based. It's or sunscreen that says suits all skin types. Such kind of sunscreens can be used, and moisturize your skin well. Moisturizer is the mantra to get rid of a sensitive skin or irritated skin. You can apply moisturizer multiple number of times, but if it is sensitive skin, make sure that you also watch out the ingredients, layer it well, and apply lightweight moisturizer. Those few things, if you can follow, that should calm down your skin if there is no other condition.
Right. So that can help. Alisa William is asking, what is vitamin C and how does it add to my skincare routine? I would also like to add, doctor, that you initially said when we were talking about how to prevent melasma, that intake of vitamin C enriched and antioxidants, can actually help to strengthen your skin or make your skin melasma free or prevent it from getting melasma. Now, these days, a lot of vitamin C serums are also coming, vitamin C based creams, etc. are also coming. Are they also safe to use?
Vitamin C, now coming to the question, what is vitamin C? Vitamin C is a vitamin that is, it has a lot of benefits. First thing is it helps in your immune booster, which all of us during the pandemic season, we've seen how much of vitamin C has been helped us or has been supporting us or how much we craved for vitamin C. So that's the major job of vitamin C, to make sure that your immunity is protected. It can also act as an anti-inflammatory. It is a very powerful antioxidant. Antioxidant is what we use to reduce any form of oxidative stress happening in the skin. So when I do not say it's only skin, it is also for the body. So if you take a person who's having inflammation in their body, any form of inflammation, जैसे कि हम COVID virus देखे थे, that is also an inflammation. So taking vitamin C will calm all that oxidative stress in the body. So taking oral vitamin C is good. How does it add to my skincare routine? I usually tell my patients to take the oral form of vitamin C because there is no skin type for oral vitamin C. But if you want to apply a cream, not every vitamin C again suits all skin types. But this, not everyone actually thinks. Vitamin C supports, it's good, just keep applying whichever brand, how much of a quantity. That's not how it works. Vitamin C is a very unstable product. So if you're not able to get an oxidized version, or if you're not able to get a proper vitamin C, it gets oxidized. It can actually turn your skin more browner because of the oxidation. So not every cream can be just grabbed and applied, but if you can get a right vitamin C around, if you're a starter, I say usually if you're a starter, if you don't know what kind of percentage that you want to pick some vitamin C, plain vitamin C, apply in the night, which is less than 10%, serum form, cream form, any form. But do not play around with vitamin C just because you think it's a very good thing and nothing happens, no side effects, it's a blade thing. Vitamin C, because none of us want to have browner skin, even if you're browner. If you do not want to end up more browner, then please do not play around with vitamin C and make sure that you pick the right percentage. Oral vitamin C, I definitely would indicate everybody with pigmentation, without pigmentation, to have a healthy skin. Please take your vitamin C every day orally for a good health as in general.
Right. We have Priyanka Daheria asking, how do I avoid a white cast with sunscreen?
White cast with sunscreen, it's usually seen from physical sunscreens mostly. It's a zinc oxide titanium dioxide that causes your white cast. So if you do not want to have a white cast with sunscreen, because not everyone doesn't want. I personally like having that white cast on my skin because it gives a better glow is what I feel. Most of the cricketers or the athletes whom you see, they have that white layer on the cheeks and nose because that's a zinc oxide. It definitely has its effect. If you do not want to have a white cast, just don't use physical sunscreens. Use chemical sunscreens with no zinc oxide or titanium dioxide.
Right. Tamanna Seth is asking, I have really bad tanning and pigmentation all over my body. How to get rid of it?
If your skin color has changed, mostly it's dry skin that ends up in pigmentation, a chronic dry skin. If your skin is normal, most of them think my skin is normal, I don't feel dry, let me not apply moisturizer. So that way you're dehydrating, you're taking away all the water from your skin. So most of the skins, without knowing, they end up in dehydrated skin, not a dehydrated body. That can cause, in general, pigmentation of your whole body and making you look a little darker than what your skin tone is. So please make sure that you apply a proper ceramide-rich moisturizer every day, morning and evening. Again, vitamin C will definitely help you in getting back your tone if tone is what you're looking for. And if there's anything else, a medical cost to it, it's always better to visit your dermat.
Right. And doctor, can melasma or pigmentation turns into cancer?
For Indians, no. There is 1% risk of melasma or any pigmentation to turn into cancer, but for Indians, we see skin cancers coming up in a very less percentage.
We have Rekha Maran. Her question is, my skin is too oily. What can I do to get rid of it?
Skin, if it is too oily, first thing is use a good face wash, which is not just basic cleanser, proper face wash, which gives you right foam. And second thing is use something like, I'm not sure what her age is, but use a sunscreen that is gel based that will prevent oily skin throughout the day. And use a moisturizer, especially non-comedogenic moisturizer on your skin. So once your moisture is picked up on your skin, two things. One is you have over excessive oil production on your skin that can cause oily skin, or if you have dry skin or if you do not have proper hydration in your skin, to compensate it, your skin produces more oil. So it means that your skin is dehydrated. So if you think your skin is getting too oily, then please make sure that you maintain the hydration of your skin. Again, when I say hydration, people think, no, I drink a lot of water. Water, only 3% of water reaches your top layers of your skin, just 3%. Even if I drink 10 liters, 3% of it goes to your skin. So drinking water is essential as much as applying a moisturizer to your skin is essential. So if you can maintain the pH balance by applying a gel sunscreen, non-comedogenic, lightweight moisturizer, that should do most of the job, and using a face wash rather than just a gel or a cleanser. Active ingredients will only be given to you if you're visiting a dermat directly, but not just by recommending without understanding your skin.
Okay, Saloni Mehra asking, how can lip depigmentation laser treatment and facial hair laser treatment be done together in the same sitting?
It depends on what laser and what part of your face that you're getting the laser done. If they both are done in two different parts, if the lip pigmentation laser is not included on the skin, the depigmentation laser sirf lip pe kara rahe ho and your facial hair is somewhere on the skin, that should be fine, as long as they're not crossing the same or overlapping.
What are, doctor, the most common mistakes that patients, especially with melasma or hyperpigmentation, commits?
I didn't get your question, I'm sorry.
What are the most common mistakes that people often do that make their skin condition worse?
Is it after having the condition or before?
Yes, after having condition. Yes.
Is they want to scrub it off. They think, acha scrub karo nikal jayegi. Like how we wash clothes, just get the dirt out of the clothes. Acha scrub karo nikal jayegi. That's the worst thing, because doing the scrubbing part, you're irritating your skin and you're producing more pigmentation. Once the damage happens, any damage heals with a mark, a darker mark or a black mark. So please make sure that you do not scrub or exfoliate something actively. Your regular exfoliation is good, but go gentle on your skin when you're having melasma or hyperpigmentation. You should exfoliate, but only once in a month or twice in a month. And using the scrub particles, that's a very huge topic, but using your scrub particles, size and the ingredients is very important when you're scrubbing. Second one is directly applying some kind of topical steroids or any creams that they see on YouTube, read on the internet and applying it and worsening it. temporarily light ho jayegi, whatever creams you apply, but it will not heal it completely. So please do not use your random creams and do not scrub it. Those are the major things that they do.
Okay. And before we conclude this session, any takeaway message for our viewers, Doctor?
Please visit your dermatologist at the earliest whenever you have any pigment issues. If you think there is something starting part, directly come to a dermat, because they think doctor ke paas jayenge, paise waste ho raha hai. No, paise waste nahi hote, because you will gonna get a really good skincare routine. Paise tab waste hote when you go around, waste your money on some random product, spoil your skin, and then you come to us. That's a lot of thing to spend on. So come to us in the earlier phases. If you cannot, or if you do not want to come, good, do not try anything on your own. Either you don't try it or you try it with us. That's the only thing that we say. Please don't buy into whatever you see on the internet on yourself, because everyone's skin is different. Understand your skin before you try any products. And I would definitely tell everybody, whoever is watching, to listen, to remember, and also to spread the news not to apply anything that contains topical steroids without a prescription, or at least for a right cause, for a long time. That's it.
Thank you so very much, Dr. Alekya. It was lovely having you, and thank you for your valuable time. If you want to consult Dr. Alekya Singapore, you can book an appointment on call. 90146 96430 is the phone number. Email ID is dralekyasingapore@gmail.com. For visit to the clinic, the Skin Sense by Dr. Alekya Singapore Skin and Hair Clinics, Bhavia's Fantastica, flat number 202, road number 12, Banjara Hills, Hyderabad is the address. Timings are from morning 11 to 2 p.m. and Monday to Saturday you can visit her. You can also visit www.theskinsense.com, and please stay connected to our beautiful Spotless Skin page. Thank you. Goodbye.
Bye.
Like, subscribe, and press the bell icon. Thanks for watching.